Hello, my name is Jose Aguilar, and for my presentation about healthcare product or service that is currently on the market, I've chosen to talk about telehealth, also known as virtual medicine. First off, what is telehealth? The term telehealth refers to the entire spectrum of activities used to deliver care at a distance without direct physical contact with the patient. Telehealth encompasses both provider to patient and provider to provider communications. This can be achieved through phone calls or video calls, even messaging systems or emails. Telehealth is not a new form of healthcare service since it started in the 1960s through radio mostly, but since the pandemic of COVID-19 in the past 2 years, virtual healthcare has become increasingly more popular and can address multiple issues that regular inpatient healthcare was having troubles with. So, what are some of the benefits that virtual healthcare has to offer? It became so popular during COVID-19 because no one wanted to be exposed to the virus. Therefore, a virtual meeting with a doctor was the safest way to prevent this. Some of the ways virtual healthcare can benefit the patients are limited contact with the patients, reduced exposure to COVID-19 virus. It can ensure you get healthcare from wherever you are located if you have access to internet or a phone. Virtual visits cut down on travel, time off of work, and the need for childcare. Virtual healthcare tools can shorten the wait time for an appointment. Increased access to specialists who are located far away from your hometown. And it also allows doctors to provide services to more patients, including in non-regular office hours. What kind of care can a patient get through telehealth? Although there are various reasons for why a patient still needs to physically go into a clinic, there are a variety of things that a patient can use telehealth and not have to make the trip to their clinic or hospital, and some of these are lab tests or x-ray results, mental health treatment including online therapy, counseling, and medication management, recurrent conditions like migraines or urinary tract infections, skin conditions, prescription management, urgent care issues like colds, coughs, and stomach aches, post-surgical follow-ups, treatment and follow-up appointments for attention deficit disorder and attention deficit hyperactivity disorder, also physical therapy and occupational therapy. Now, how is telehealth being advertised? Telehealth is no different from other services in healthcare when it comes to marketing. It still needs to follow all the rules and regulations provided by HIPAA and the ethics in healthcare. Even though telehealth is not a product but a service, the form of advertising that is used is product advertising, since institutional advertising only aims to improve the reputation of a company or institution. And some of the ways that healthcare institutions are promoting virtual care is through the institution's website, social media such as Facebook, Instagram, Twitter, or YouTube ads, via email through existing patients, as well as Google Ads. As mentioned in the previous slide, the same requirements that apply for in-person services apply to these telehealth services, and the storage of personal information from their patients and their electronic health records such as their electronic files, videos, and photographs. There are certain features that providers look for in order to stay compliant with HIPAA regulations, which are fully encrypted data transmission and no storage of video. Some consumer-grade services such as Skype and FaceTime should never be used for this purpose because they are not encrypted services. I also found this very informative brochure from the Social Security Administration that covers some basic steps for HIPAA compliance. This is a list of references that I used for information during this project.